Hello everybody and welcome back. This is Dr. Mritula V. Amarnath here. So how is your journey of pregnancy going so far? Well, there is this one question that people ask, as soon as they know that you're pregnant. Do you have vomiting? Do you have the nausea sensation? Right? Have you been asked the same? Well, this vomiting sensation or vomiting nausea is very common, especially during this first trimester. And let me tell you, nearly 70% of the pregnant ladies actually have this. And if you don't, you're really lucky, I must say. Okay? But it is common, it is very common. So it is not unusual to feel that sense of nausea, and vomiting. And you don't feel like eating, decrease in appetite. It's all extremely common. So do not worry. And why? And most things, it can happen during any time of the day. There's no particular period, when, probably in the mornings or evenings, nothing of that sort. Probably even the smell of some food which you previously liked can be a triggering factor and cause nausea. Even the sight of something or, something you would be really surprised to know can be a triggering factor for your nausea. So, it is just very normal and it will come down eventually. So stay tuned to know more about why this happens and what we can do to get rid of it, or at least not rid of it, to help us feel better. So typically the symptoms of this morning sickness, it starts by around 6 weeks, it peaks by around 10 weeks and slowly starts tapering down by around 14 weeks. So it is not going to harm you nor the fetus, but there are certain cases when it is of extreme conditions. Well, that is a completely different story. But regular nausea and vomiting during the first trimester is absolutely normal. Here are some ways that you can cope up with nausea and vomiting. 1. Make sure you drink or eat plenty of clear fluids. Okay? Eat bland crackers or dry roast. You can also follow the brat diet, which includes banana, rice, applesauce, toast, tea. Make sure you have 5 or 6 small meals each day. Drink plenty of water 30 to 45 minutes after eating solid foods. Probably you could also take your prenatal vitamin with your meal. As much as possible, try to avoid bothersome smells and odors. Make sure you try and get yourself distracted and try and get plenty of fresh and cool air. Sit up and stand up slowly during this period. And in case if it is too severe, unbearable, then it is better that you ask your doctor for treatment medications. So like I said, for most ladies, by the time they end of their first trimester, they slowly start feeling better. Your nausea, vomiting episodes slowly start reducing. But for certain ladies, what happens is it still persists and gets worse. It can even lead to a loss of weight and even dehydration and even certain alarming signs where that should be a matter of concern. So some of the signals that should alarm you are vomiting any fluid for more than 1 day, losing drastic amount of weight, urinating only a small amount of urine that is dark in color, feeling excessive thirst, there is a racing or pounding of your heartbeat, feeling dizzy and tired, and even vomiting blood. So in such cases, it is important to immediately rush the patient to the hospital and the patient would be immediately started on IV lines. It's because the patient should not get dehydrated. You cannot get dehydrated and immediately started on antiemetics medications. So like I said, having this nausea, vomiting or the morning sickness as we call it is absolutely normal. But even after the first trimester, if it continues and if we notice these alarming signs, then it is a matter of concern. Okay? So stay safe. Bye-bye.